What I think is the need of the hour. We are looking at future collaborations. I think it is already too late. We need to really think what is happening. What is happening is that we lost it long back, and the earlier we get the hang of it, the better it would be. Everything has been polluted in terms of maybe development, maybe convenience, maybe what we call modernization. But where has it landed us? We all thought during those lockdown days, possibly the world will never be the same.
Mr. Sandeep Nelwal is one of the co-founders at a company called Polygon. I think Sandeep put out a tweet to his community. By virtue of who he is, he was able to reach out to people in his network and actually garner support. The volunteers who were doing this, we also started to form strategies on how we could do this in the long term.
COVID came as a bolt out of the blue, which brought the whole world to a standstill, which I'm sure no one in the world ever imagined that we could land in such a state. But what have we learned from it?
What we've also done during that time is strengthened infrastructure. So there was requirement not only to do sequencing, which we collaborated with Strand Life Sciences, but also to support infrastructure that will facilitate certain work and preparedness. So one of the things that we have done was wastewater surveillance center at IIT Madras.
And I'm sure this environmental surveillance will fill that gap, and we will be able to understand and detect disease well before it enters into the human life. I'm happy that environmental surveillance and the organizations who have come forward, along with countries' best institutions like AIIMS, PGI, and other INIs, will address this issue and join hands and commit that the future generation live in a very healthy and safe environment.
We realized that there were a lot of challenges, right? So we all learned a lot from COVID. And one of the things, as rightly mentioned, is we really need to collaborate, bring different sectors, scientists, policymakers, medical sector, innovators, everyone together to solve the problems that may arise tomorrow.
In all the activities we do, the major stakeholder we usually ignore is the patient.
There were 5 projects to submitted. Hyderabad got 1, IIT Mumbai got 1, IIT Delhi, IIT Madras also got 1. So we are now coming as a phone group, all these 5 projects.
Small steps by each one of us go a very long way.
We are pleased to announce that Blockchain for Impact will be supporting 5 institutes for a grant of 50,000 each for this biomedical research and innovation in public health program. And we do hope that this program will actually bring us more together and will work together for this specific cause.
Severe and unpredictable weather events, fueling disease outbreaks and contributing to high rates of non-communicable diseases. We can help protect the health and well-being of the people facing the perils of climate change by working together and make high-quality climate services more accessible to the health sector.
It is important to have different platforms. We have to have diversity. Therefore, it also challenges us to say, what is the value add? What is the differentiator? Because the world is so big and the challenge is so huge that no one organization or no one platform can solve it. We need it all. And therefore, a platform of platforms where we share what we're doing will make us more efficient. We won't repeat things. If you're collecting sewage and testing for COVID in Bangalore, then somebody else should not collect it. They should think of something else to be done. So moving beyond competition and actually collaborating by sharing that we're not duplicating and using our resources in a catalytic way would possibly be a good way to go.
Today, it is not only a matter of doing something. I think it is a matter of how long do we want to exist as a species on Earth. Dinosaurs may be long remembered, but I'm sure they have taught us one thing. You will have to work to survive, and in a manner where we succeed.